it's a very wide-ranging sort of area. And because it's wide-ranging, you're going to have people with very clear views and very clear experiences who have very strong opinions about what works and what doesn't work, and what the solutions are for the people that they've looked after or that they've experienced. And in that sense, it's all the more important that we have evidence to back up anything we do, because it would be just so easy to go with the voices that are strongest about what they think the solutions are. And it's just really important for commissioners particularly to understand the whole range of interventions that's available, the whole range of service models that are available, and what the evidence is behind them. It immediately conveys the sense that there isn't a simple answer to what we're trying to do. That's the first thing. I think the fact that you've themed it around right care, right place, right time gives us that breadth. And of course, within that, you have a range of methodologies. But also where you have identified a lack of full understanding is equally important, because we need to know what we don't know as much as we need to know what is already known. This research will only happen in the real world setting if commissioners appreciate that the time and the resources that are required to actually participate in this research. But there is, of course, another group, which is the chief executives, the clinical directors, the director of finance. All those people is actually, I think, is a rather good read for them, because it helps to digest the evidence and helps them to understand not only what needs to be done, but also why it needs to be done. I think the other thing that's really encouraging about some of the studies that you've included in this review, of course, has been looking at other conditions that are, if you like, less commonly studied perhaps in the context of end-of-life care. So the dementia and the COPD and so on, and those are conditions we so desperately need to understand. And then the whole area of multimorbidity and frailty and older people. So getting much better evidence around that will not only help our understanding, but also help service development. We don't know enough about what are the inherent problems that are related, inherent issues that are related to the condition itself, and then to multiple conditions. Of course, that's another layer of complexity. But also we don't know that the kind of models of care that we've got used to in palliative care and end-of-life care for cancer necessarily translates directly for other conditions. It will need a translation. I think perhaps the area I would like to see more research on is around the inequalities. The groups that are smaller, the groups that are more marginalised. We know there are inequalities. It's actually what's our most effective way of trying to redress that. One of the exciting things about reading the themed review is also about the studies that are ongoing right now. And you have quite a breadth of work around how GPs and community nurses better support patients, work in care homes, volunteer-led support. So I think those are kind of that they're really important pieces of evidence that are sometimes harder to get hold of. If we're talking about research that benefits people who have palliative and end-of-life care needs, well, they are in every setting. Therefore, we're going to understand it. We need to understand it in every setting. Professional development is such a major part of what makes it work for people on the ground, really. So understanding that interaction, and you do have some work around communication and understanding that interaction between the person who's working with the patient and the patients and families themselves. Family, or the person who is either the carer or closest to the patient themselves, is the person who holds the common thread. Often just by default, because they are there in every setting. Often they want to, sometimes because they have to, and I guess it's that last bit that we need to be careful we don't, that we're able to support. And actually really what we're all trying to get at is what really matters to the person, and what really matters, of course, is different from person to person, but also might shift over time. And that's probably the sort of the nub of what we need to hold on to, is this understanding what really matters.